You know, here at One Accord and the Pelvic Docs, we're always looking for better, smarter ways to help you heal. And today, we're going to talk about something that is truly a groundbreaking approach to recovery. It's changing how we think about building strength, especially when those traditional heavy lifting methods just aren't on the table. We are talking about blood flow restriction therapy, or BFR for short. Have you ever felt like you've just hit a wall in your physical therapy? Maybe you're trying to bounce back from surgery, or you're dealing with an injury that just won't quit, and that road to getting stronger just feels impossibly long, maybe even a little hopeless. I promise you, you are not alone in feeling that way. You always hear that you've got to lift heavy weights to build muscle, right? But what are you supposed to do when that's the one thing that causes pain? Or your body is still just too fragile after an operation? It can feel like you're completely stuck, unable to make the progress you're working so hard for. But what if there was a different way, a smarter way to get that strength, but without all the strain? Well, that's exactly where blood flow restriction therapy comes in. And honestly, it's a complete game changer in how we approach rehabilitation. So what is BFR, really? Well, to put it simply, it's a technique where we use a specialized cuff, kind of like a blood pressure cuff, to apply some gentle pressure to your arm or leg. This simple step allows you to do really light exercises and still get incredible muscle growth. The key words there are gentle and light, which makes it an amazing option even when your body feels compromised. And just look at this comparison, it lays it all out. With traditional training, you're lifting heavy. We're talking over 70% of your max, which puts a ton of stress on your joints. Now look at BFR. You're lifting at just 20 to 40%. The joint stress is super low. But, and here's the kicker, look at that line for muscle growth. It's excellent, just as good as heavy lifting. It's the perfect solution for anyone who's post-op, injured, or just feeling a bit deconditioned. Now, I know this might sound a little bit like magic, but the science behind it is just fascinating. It's all about creating the perfect environment for growth. You're essentially tricking your body into thinking it's working way, way harder than it actually is. It all boils down to a really simple three-step process. First, that gentle pressure from the cuff creates a low oxygen environment in your muscle. Step two, this environment sends a powerful signal up to your brain, the exact same kind of signal it would send if you were doing a super intense heavy lift. And finally, your body responds to that signal by flooding the area with growth factors and speeding up protein synthesis, which is the absolute key to building new muscle. So let's peek behind the curtain at the magic. This process creates what we call metabolic stress, which is like rocket fuel for muscle growth. It forces your body to recruit those powerful, fast-twitch muscle fibers that are usually only used for a maximum effort lift. Plus, it kicks off this amazing hormonal response, boosting things like growth hormone, while also telling your body to chill out on myostatin, which is a protein that literally puts the brakes on muscle growth. Okay, the science is cool for sure, but the most important question is, how does this actually apply to you and your specific recovery journey? Let's take a look at some of the real-world situations where this shines. I just want you to take a second and think about where you are in your recovery. Whether you're getting ready for a procedure or you're in the middle of healing from one. Could this be the tool that finally helps accelerate that process and gets you back to your life faster? I mean, if you have a surgery scheduled, BFR can be a total game changer. For things like a spine fusion or a total knee replacement, we know that going into surgery stronger leads to a much better recovery. BFR lets you build that strength beforehand, which means less muscle loss and a better outcome, all without putting stress on the very joints you're about to have fixed. It's incredible. And then, after surgery, that's when your body is at its most vulnerable, right? Well, BFR is an incredibly safe way to get moving again. It protects those delicate healing tissues because the loads are just so light. And that means you can start rebuilding strength and fighting off muscle loss much, much earlier in the rehab process. It just safely speeds everything up. And hey, this isn't just us talking theory. The research on this is so clear. Take rotator cuff surgery. That's a notoriously tough recovery. Well, one study found that patients who used BFR had significantly better outcomes and better range of motion just 6 weeks after their surgery. I mean, that's a real, tangible, life-changing difference. And BFR isn't just for recovering from surgery. It is a fantastic tool for older adults or really anyone who's feeling deconditioned. If you're dealing with things like arthritis or just general muscle weakness that makes heavy exercise feel impossible, BFR gives you a safe and really effective way to build the strength you need for a better quality of life. And here's another piece of evidence that it blows my mind. Research shows that for older adults, light exercise with BFR can improve muscle strength and size just as much as traditional high-load training. It really is the definition of working smarter, not harder. You give your body the signal it needs without all that physical stress. But here's where it gets even more interesting. The benefits of BFR don't just stop at the muscle you're working. The effects are systemic. It actually creates this cascade of positive changes all throughout your body. For example, studies have shown BFR leads to significant reductions in knee pain. It can help improve bone density, which is so crucial as we get older. It's even been shown to improve cardiovascular fitness. And this last one is maybe the wildest of all. There's something called a cross-transfer effect. It means training one leg with BFR can actually make your other leg stronger, and even your arms. It's amazing. Now, with all of this, you're probably asking a very important question. Is it safe? And this is probably the most compelling number of all. A major review looked at all the research and found zero, that's right, zero, detrimental outcomes directly caused by BFR training. When it's done correctly by a trained professional, it is an incredibly safe and effective tool. So, when we put all this together, what are we really talking about for you? Well, it means moving beyond just managing your symptoms. It's about finding a path to true, lasting restoration. So if you have felt stuck, if you've been frustrated by a lack of progress, I really want you to hear this. You don't have to stay there. A path forward really does exist, and it's built on smart science that is designed to work with your body, not against it. Because at the end of the day, this is what it's all about. It's why our therapists here at One Accord and the Pelvic Docs are so passionate about this technology. It's not just about less pain or more muscle. It's about restoring your function so you can get back to living your life with renewed hope. If anything we've talked about today sounds like it could be for you, the next step is so simple. Just start a conversation. Ask your therapist at One Accord Physical Therapy or the Pelvic Docs if blood flow restriction therapy might be the key to unlocking your recovery. Just think, what could you get back to if you could build strength without the strain?